Heart failure affects millions worldwide, challenging healthcare systems and impacting lives. The 2022 ACC/AHA guidelines provide updated, patient-centered recommendations based on the latest research. They emphasize personalized treatment and lifestyle changes, such as diet, exercise, and medication adherence. The guidelines promote evidence-based decision-making for consistent quality care. Understanding heart failure stages is crucial for tailored treatment plans. A multidisciplinary approach involving various healthcare professionals is essential. Effective communication and coordination ensure integrated care and better outcomes. Regular monitoring and follow-up optimize patient health. The goal is to improve quality of life for heart failure patients. Early diagnosis and effective treatment aim to reduce hospitalizations and enhance survival. Diagnosing heart failure requires a comprehensive evaluation, including specific diagnostic tests. Echocardiography assesses the heart's structure and function, providing valuable information about ejection fraction and valve function. This non-invasive imaging technique uses ultrasound waves to create detailed heart images. Natriuretic peptides, like B-type natriuretic peptide, are blood markers that elevate in response to heart stress. These peptides help distinguish heart failure from other conditions with similar symptoms. Elevated levels can indicate heart failure, even in early stages. Accurate diagnosis is crucial for initiating appropriate and timely treatment. Early diagnosis can significantly improve outcomes and prevent disease progression. Heart failure is classified based on ejection fraction, the percentage of blood pumped out of the left ventricle with each heartbeat. This measurement is crucial for understanding the heart's efficiency and overall function. Heart failure with reduced ejection fraction, HFrEF, indicates impaired pumping ability, meaning the heart muscle is too weak to pump blood effectively. Heart failure with preserved ejection fraction, HFpF, occurs when the heart's ability to relax and fill with blood is compromised, even though the pumping function remains normal. HFpEF presents unique treatment challenges and is increasingly prevalent, especially among older adults and those with hypertension. The 2022 guidelines emphasize recognizing and managing HFpEF effectively, highlighting the importance of tailored treatment strategies. Heart failure with mildly reduced ejection fraction, HFmrF, represents a transition zone requiring careful evaluation and monitoring to prevent progression. Understanding these distinctions is essential for tailoring therapy to individual needs, ensuring each patient receives the most appropriate care. Heart failure with improved ejection fraction, HFmPEF, applies to patients whose ejection fraction improves after treatment, indicating a positive response. Despite improvement, ongoing monitoring and management are necessary to maintain heart health and prevent relapse. The ACC/AHA guidelines use a stage-based approach to classify heart failure. Stage A focuses on preventive measures for individuals at high risk. Stage B includes those with structural heart disease but no symptoms. Treatment aims to prevent symptom development and slow disease progression. Stage C comprises individuals with structural heart disease and current or prior symptoms. Treatment focuses on relieving symptoms and improving quality of life. Stage D represents advanced heart failure with persistent symptoms. Advanced therapies may include heart transplantation or mechanical circulatory support. The focus shifts towards managing symptoms and providing comfort. This staging system guides treatment decisions and monitors disease severity. Pharmacological management of HFrEF has evolved with newer drug classes. The 2022 guidelines emphasize 4 core drug classes: SGLT2 inhibitors, ARNIS, beta blockers, and MRAs. These medications improve outcomes and reduce mortality in HFrEF patients. SGLT2 inhibitors, initially for diabetes, reduce heart failure hospitalizations and cardiovascular death. ARNIS offers superior efficacy compared to traditional ACE inhibitors. Beta blockers reduce heart rate and improve heart function, while MRAs reduce fluid retention. The guidelines recommend initiating these drugs at maximally tolerated doses early in HFrEF patients. Treatment should be individualized based on patient characteristics and response. Regular monitoring is essential to assess medication effectiveness and adjust dosages. Managing HFpEF and HFmPEF presents unique challenges. The focus is on managing comorbidities and addressing specific symptoms. The 2022 guidelines emphasize treating underlying conditions like hypertension and diabetes. Diuretics help reduce fluid retention and alleviate shortness of breath. SGLT2 inhibitors may offer benefits in HFpEF, particularly in reducing hospitalizations. For HFIMPF, continue therapies that led to EF improvement. Regular monitoring ensures F stability and assesses symptom recurrence. Managing HFpEF and HFIMPF requires a personalized approach. Ongoing research aims to identify more effective treatments. Device therapies like ICDs and CRT play a crucial role in managing heart failure. ICDs detect and correct life-threatening arrhythmias. CRT improves pumping efficiency and reduces symptoms in HFrEF patients with a wide QRS complex. The 2022 guidelines provide criteria for selecting patients for ICDs and CRT. ICDs are recommended for HFrEF patients at increased risk of sudden cardiac death. CRT is indicated for HFrEF patients with a wide QRS complex and persistent symptoms. These therapies can significantly improve outcomes and reduce mortality. Careful patient selection and appropriate device programming are essential. Lifestyle modifications are essential for managing heart failure. The 2022 guidelines emphasize sodium restriction, regular physical activity, and weight management. Sodium restriction reduces fluid retention and blood pressure. Regular exercise improves cardiovascular fitness and reduces fatigue. Weight management reduces strain on the heart and improves its efficiency. Other important modifications include smoking cessation and limiting alcohol intake. Adopting these changes can significantly improve outcomes and slow disease progression. Healthcare professionals should encourage and support patients in making these changes. These modifications help alleviate symptoms and reduce the risk of complications. Advanced therapies may be necessary for stage D heart failure. These include heart transplantation, mechanical circulatory support devices, and palliative care. Heart transplantation is considered for carefully selected patients with end-stage heart failure. Mechanical circulatory support devices help the heart pump blood and can be used as a bridge to transplantation or as destination therapy. Palliative care focuses on providing comfort and improving quality of life. It involves a multidisciplinary approach addressing physical, emotional, and spiritual needs. The decision to pursue advanced therapies should be made in consultation with a heart failure specialist. A shared decision-making approach ensures the chosen therapy aligns with the patient's goals. Patient education and shared decision-making are essential for effective heart failure management. Educating patients about their condition and treatment options empowers them to participate in their care. This includes understanding medication adherence, lifestyle modifications, and follow-up appointments. Shared decision-making involves a collaborative approach between the patient and healthcare team. It emphasizes respecting patient preferences and values in treatment decisions. Effective communication is crucial for fostering shared decision-making. Patients should be encouraged to ask questions and express concerns. Empowering patients leads to improved adherence, better self-management, and enhanced quality of life. It also fosters a sense of control and improves patient satisfaction. Healthcare professionals should prioritize patient education and shared decision-making. The 2022 ACC/AHA Heart Failure Guidelines provide a comprehensive framework for managing this complex and often challenging condition. They emphasize a patient-centered approach and personalized treatment strategies, ensuring that each patient receives care tailored to their unique needs and circumstances. Staying current with these evolving guidelines is crucial for optimal patient care, as new research and clinical trials continuously inform best practices. The guidelines cover a wide range of topics, including diagnostic testing, pharmacological and device-based therapies, and essential lifestyle modifications. Adhering to these guidelines not only improves clinical outcomes but also significantly enhances the quality of life for patients. Continuing medical education is essential for staying abreast of advancements in heart failure management, as the field is always evolving. Healthcare professionals should actively seek opportunities to update their knowledge and skills through various educational platforms and training sessions. By staying informed and engaged with the latest developments, they can ensure patients receive the most effective and up-to-date care available. This commitment to lifelong learning and professional development is essential for providing the best possible care for heart failure patients, ultimately leading to better health outcomes.